Good afternoon, everyone, and welcome to the Massey Community Cancer Forum, where cancer, community, and conversation connect. My name is Jarrell Hines. I'm a member of the community engagement team here at the Massey Comprehensive Cancer Center, and on behalf of the Office of Community Engagement, I want to extend our deepest gratitude that you've chosen to spend this hour with us. As many of you know, January is Cervical Cancer Awareness Month. So today's forum is especially timely. Cervical cancer is one of the most preventable cancers we face, and increasing awareness, screening, and vaccination can save lives. That's why conversations like this matter, because when our community is informed, our community is empowered. Today, we'll be focused on cervical cancer prevention, HPV vaccination, and screening guidelines. So again, the forum is all about cancer and community and conversation connecting. So we're encouraging you guys throughout it to network, have conversation, tell your friends about it. While we're here now, post about it. I'll even smile for a minute. Cheese, you got your Facebook post. So go ahead and share it with your friends because I'm telling you, we can do this together as a community to beat this one fight against cancer. So next. So I have the distinct pleasure of introducing our speaker for today, which is Dr. Sallier. So today we're joined by Dr. Sallier, a specialist in the care of women with gynecologic cancers and a leader whose commitment to patient-centered care is matched by a deep passion for reducing health disparities. Dr. Sallier brings a wealth of clinical expertise, but also something just as important, a belief that every woman, regardless of background, deserves access to high-quality, compassionate cancer care. Dr. Sallier currently leads the Gynecologic Oncologist Clinical Trial Program at VCU Health, where they work to expand access to innovative treatments and ensure that women across our communities have opportunities to participate in research that can change and save lives. Their leadership in clinical trials is helping shape the future of gynecologic cancer care, bringing cutting-edge science directly to the patients who need it most. So join me in welcoming Dr. Sallier. Hi, Dr. Sallier.
Hello. Thank you so much for having me. I'm so excited to join you all today. Um, and yes, I'm going to give a presentation. We're going to talk about HPV and how we can prevent cervical cancer. But I do invite your questions throughout. Please feel free to pause me, put them in the chat. I'm happy to discuss as we're going along. So again, really nice to meet you all. My name's Chelsea Sallier. I'm a GYN oncologist here at VCU. And today I'm going to be discussing HPV vaccines and cervical cancer, what everyone should know. So my goal for this talk is really for you guys to understand what is cervical cancer and what are some risk factors. But more importantly, I want you all to feel empowered to go out for yourself, for your family, and for our community members as a whole. How can we actually prevent this cancer? What is the role of the HPV vaccine? As well as cervical cancer screening, and how can we all access these services? So first, what is cervix cancer? This is a malignant growth at the opening of the uterus. And while the cervix and the uterus aren't close neighbors, they actually are separate organs. So this is confined to just that opening of the uterus. It initially starts here in the cervix, but can spread and become a life-threatening disease. The average age of diagnosis is around 50, but the precancerous changes start 5 to 15 years earlier. So this means with regular screening, we can find the precancerous changes, treat them, and prevent this from ever becoming a cancer. This used to be one of the leading causes of cancer death among women in the United States. But again, thanks to prevention measures, specifically the HPV vaccine, surveillance testing, and treatment, this is now slowly but surely becoming less and less common. In the United States, there's an estimated 300,000 women who are living with cervical cancer. Most of them, around 70%, are diagnosed at an early stage when the disease can be cured. But about 30% or 100,000 women in the US are diagnosed at advanced stages when lifespan is only about a year. We're actually doing a pretty good job in Virginia. The incidence in our state, you can see we're one of this nice dark blue colors, one of the few that are. with only 5.9 cases per 100,000 compared to 7.5 cases per 100,000 in the US at large. So what causes cervical cancer? 95 to 99% of cases are caused by the human papillomavirus, or HPV. And this follows a very predictable sort of lifespan that we see. So once the cervical cells become exposed to HPV, the viral genome actually integrates into the cells of the cervix. And over a period of, again, usually 5 to 15 years, this becomes what we kind of call a low-grade dysplasia, and then a high-grade dysplasia, or dysplasia is another word for precancer, that then becomes cancer itself. So this, again, means we have anywhere from 5 to 15 years to intervene and treat these precancerous changes and prevent them from becoming a cancer. A little bit more about HPV. This is a virus that's transmitted through sexual activity, and every single person has it in their lifetime. It's not a matter of when, if, why, how, what. Every single person is exposed. It's just prevalent throughout our communities. But the difference is that, there's kind of a little angel version and then the devil version. Fortunately, the angel version is more common. This is a group of over 200 HPV strains that are considered low risk. Our immune systems are really good at clearing these on their own. So even if you do get exposed or infected with one of these HPV strains, your body gets rid of it on average between 1 and 2 years. But the not so nice HPV strains, specifically HPV 16 and 18, as well as a group of 12 others, those our body has a really tough time fighting off on our own. And those are the strains that, again, will develop into those precancer changes called dysplasia and eventually can become cancer. But like anything, there's lots and lots of other variables that factor into whether or not a person develops cancer in their lifetime. And HPV is really not the only risk factor. There are other behavioral factors, socioeconomic risk factors, public health and genetic factors that all come into play. And unfortunately, what I can tell you is those folks that may have some of these behavior risk factors, like multiple sex partners, smoking, they may have altered immune responses due to chronic stress. Those are the same folks who also have the socioeconomic risk factors, like limited access to health care, not having the means to seek preventive tests and services, don't have time to take off work and go to a doctor and get a vaccine, all that sort of stuff. So while these show these in nice little separate categories, these are the same group of people, meaning that those folks who are at higher risk for exposure to HPV and developing cancer are the same people who often lack access to preventive care and treatment. And we do see higher incidences of cervical cancer, especially among women of color, like Black communities and Hispanic women, folks who live in rural areas, the LGBTQ community, as well as women who have criminal legal backgrounds. So here's the most important part. How do we actually prevent this disease? HPV vaccination is absolutely key. This vaccine protects against 90% of HPV strains that cause cervical cancer and also protects you from other HPV-related cancers. It's recommended for males and females aged 9 to 26 years old. If you give it earlier, you have a nice, robust immune response, and you only need 2 doses. So earlier is better. This is also more likely to give you the vaccine before you're ever exposed to a strain of HPV. However, even after 14, it's recommended up to age 26, but then you have to give it in 3 doses. There's also data, though, that suggests that HPV vaccination can help the body clear HPV or high-grade dysplasia. And for that reason, it is actually FDA approved for up to age 45 years old. So, I see the bad side of things when folks get cancer. So I think the official tagline is supposed to be a risk-benefit conversation from 27 to 45. But if it's me, I'm like, there's no harm, just get it. But again, when you get it in later years, that has to be given in 3 doses. So how are we doing in Virginia? We're actually doing, again, pretty good. Vaccination rates are higher in Virginia than the rest of the United States. Our vaccination rate, hold on, wait 1 second. We're at 85%. Okay, or 680, sorry, I misread that. 61%. But again, behind this goal of our 2030 healthy people goal of greater than 80%. So there's definitely still room for improvement there. We also see significant rural and racial disparities. Again, where folks that live in more rural areas don't have quite the same access and are less likely to receive the vaccine. So where can you and your community members get HPV vaccine access? Of course, provider offices are always welcome. You can come see us at AOP. I'm on the 4th floor, but my colleagues in benign gynecology are on AOP 10. This is a walk-in appointment that you can get that doesn't require any sort of pre-scheduled check-in. You just need to speak to your provider for the actual prescription. You can also get these vaccines at local pharmacies, community and university health centers, as well as through the health department. The health department website also has a tool where you can find a provider for children and adolescents. It's called the VVFC program, where this gives free vaccines for children. And then for adults who have limited access to health insurance and cost coverage, there's the VVFA program. So both of these tools can be used to access the vaccine at an affordable rate. All right, so next key piece, and this is has some data that's hot off the press actually. Cervical cancer screening is key for early detection. And I want to point out that I did not use the word pap smear or pap test because our guidelines are have been changing recently. So we know that more than half of cervical cancers are diagnosed in women who have either never received screening or haven't been screened in 5 years or more. Again, because we know the natural life history of HPV and dysplasia, we typically have a window of 5 to 15 years to catch it. So really, it's those folks who are underscreened that are at highest risk for actually developing cancer. Guidelines, we do currently recommend that you don't need screening less than age 21. Again, young folks have these nice, robust immune systems. They typically clear the virus within 1 to 2 years, so there's no benefit to screening. From age 21 to 30, we do recommend cytology alone. Again, these folks, we know they have HPV, but is it changing their cervix? If there aren't any dysplasia findings, their risk of cancer, again, remains low. Age 30 to 65, that's when things get a little bit more interesting. Our immune systems aren't quite what they used to be. So if you have a persistent HPV infection at this point, you're at much higher risk. Again, we used to mostly do either cytology or what we call co-testing, which means a cytology test to look at the cells on the cervix plus an HPV virus test. But we're actually now moving to what we call primary HPV, high-risk HPV testing, which is done alone every 5 years. And we'll talk a little bit more about this on the next slide. So this is really kind of what we're thinking of as the most effective method to screen. After age 65, as long as you've had negative prior results, we don't need to do testing anymore. So why primary HPV testing? So this is actually a strategy that's endorsed by the U.S. Preventive Service Task Force, American College of Obstetrics and Gynecology, Society of Gynecological Oncology, and ASCCP, who are the colposcopy experts. This is based on many, many trials that have been pooled together with millions of patients, confirm that this is a safe and effective strategy to really identify those folks who are at risk for developing cancer. We find when we add that pap test or looking at the cells of the cervix as well, we end up doing many more procedures, something called a colposcopy, which is where we take a microscope, you look at the cervix, and then you collect a biopsy. So we do all these extra procedures, but it doesn't actually improve cancer detection. It's just more tests, more uncomfortable procedures, more costs, all these things, but it doesn't improve cancer detection. Again, the persistence of the HPV infection is the most important thing to capture. So not only does this, outcome to equivalent strategies for cancer detection, but it also allows us to improve access. So that's the other kind of key piece. If you do a pap test, you need to get this very uncomfortable looking swab all the way up to the top of the cervix. If you test for HPV alone, you are testing for viral particles basically anywhere in the vagina. So a patient themselves can swab for this. This can even be collected at home. This is a strategy that we're looking to adopt here at VCU. We're just in the process of validating our swabs and confirming that our swabs within our institution are effective, and then that's something that we'll offer here as well. So again, because of all of the data confirming efficacy, safety, quality, and improved access, this is hot off the press as of January 5th. This was published in the journal, the JAMA article, looking at cervical cancer screening guidelines endorsed by the Department of Health and Human Services. So again, they are just endorsing these same guidelines that I just listed on the same page. And will then include language that requires insurance to actually cover it, right? Because we can recommend it all day, but can patients access this, and will the cost be covered? So these new guidelines will cover high-risk HPV self-collection, and also importantly, all the testing needed to complete the screening process. We'll show this on a subsequent slide, but essentially those folks who are high-risk HPV positive, those are the folks that need colposcopies, biopsies, and potentially additional tests. And access to these tests and cost coverage has been a huge barrier historically. So these guidelines should be covered by all insurance providers starting January of next year. Okay, so just a little bit about this, but what do we do if the HPV test is abnormal? Again, those are the folks that need additional screening. So for those folks, we will get a reflex test to cytology, where you actually run how did those cells on the cervix look under a microscope, or we may have them come in again for that camera test called the colposcopy, where you collect a biopsy. And then again, the folks who are at highest risk of cancer are those with high-grade dysplasia. And we treat that by actually removing a portion of the cervix. The one on the left side, or more towards the middle, shows this loop wire called a LEAP, which essentially just removes that area, or something called a cold knife cone, which is using a scalpel to, again, remove a cone shape from that cervix. We remove all the affected cells, cervix regenerates and heals, and again, we prevent cancer. So how are we doing in Virginia? We're, again, actually doing pretty well. This is the one area, though, that we're slightly behind the rest of the US. So the guideline concordance screening rate across the United States is 51.6%, and we're at 51. So there's definitely some room for improvement. And my hope is that now that we're improving access to primary HPV screening and self-collection, that hopefully we can close this gap. So how can you access cervix cancer screening? Again, going to your OBGYN or primary care provider. Most PCPs do offer cervical cancer screening. Through the Virginia Department of Health, we also have the Every Woman's Life program, which connects folks to free cervical cancer screening. And then there's this other thing coming out. It's called a teal wand. I just looked this up to learn more about it. But there's a lot of this move to these online kind of health services. So it is a way that you get sent a HPV test kit completely through the internet. You don't have to go to a doctor. You do have to consult with a nurse practitioner, and it still is really expensive. So it's $99 with insurance, but they're essentially trying to sell you on this like fancy new device that you can then do at home. And that's actually our holdup to HPV self-collection at VCU, is they haven't validated our normal HPV brushes, that they work the same as these wands and other sort of proprietary devices that have been tested in studies. So in summary, HPV vaccination is key for prevention. It protects against 90% of the strains that cause cervical cancer. It's recommended for all males and females age 9 to 26, and it's FDA approved for up to age 45. Because again, there's some thought, even if you've been exposed to HPV, we may be able to help your body do a better job of fighting off those changes that cause cancer. You can find a provider to give free or reduced cost access to the HPV vaccine through the Virginia Department of Health. And then the other key piece is cervical cancer screening, which again is now done primarily through high-risk HPV for those women over age 30. Self-collection kits are coming soon. And also know that with abnormal results, prompt follow-up and treatment will prevent progression to cancer. And women in the community can obtain free testing through the Every Woman's Life program. All right, that's it.
Woo! Thank you, Dr. Sally. Now that you've given that wonderful presentation, I think as you could have expected, the community has questions, honey. They have questions for you. So you talk to us. So I think now's the chance to allow the community to talk back with you, right? So are you okay with that?
Oh, yeah, for sure. Do you want me to just kind of go down the
Oh
list
no, I
here?
got you. I'm gonna read it to you, honey. So,
Okay, all right.
you're the star of the show. I got you. I'm
Thanks,
not miss
Jarrell.
you. Of course. So Cassandra wanted to know, once you've been diagnosed with HPV, does it ever go away? And what symptoms do you need to look for?
That is a great question. So HPV infections actually do not have symptoms. Okay, so that's one thing about it. It doesn't cause discharge or other changes. If you do ever have symptoms like bleeding or discharge, that could be a sign of another issue. And so that's something that you should get checked out by your doctor. But the HPV and that virus itself doesn't cause symptoms. And then if you've been diagnosed, does it ever go away? That is a great question. As I said before, it really depends on the strain. If you have a low risk strain and you're infected when you're younger or before an HPV vaccine, most of the time that does get cleared by the body in 1 to 2 years. But if you have a high risk strain or you get infected later in life, your body doesn't quite have the oomph it needs to get it out of your body. And what you'll actually see is some folks get that high risk HPV. It's there. It never goes away until they get some sort of treatment. Other folks, there's actually, interestingly, you can have sort of, your immune system can sort of come and go a little bit. So maybe folks will have a period of time in their life where they're extremely stressed. And again, we know that there's a direct correlation between stress and immunity. And so their immune system may kind of back off and then HPV bumps back up. And then the next time they go get tested, maybe they're positive. But it doesn't mean they just were recently infected. It could be an infection from a long time ago. Your body has been fighting, but something happened in life that the HPV got a little ahead. So they can persist for a long time. I know that's kind of a long answer.
No,
It's a
no.
complex interaction though. But short answer is most of the time your body clears it, but not always.
Mhm. Perfect. And then,
Mhm.
Cassandra, I want to ask that question because again, we want to give the community a chance to talk. If you're still here, Cassandra, and you want to come off mute, did that answer your question? I hope I'll give you a second to come off mute or ask any follow-ups if you need to.
Yes, it did.
Perfect, perfect, perfect. Just wanted to make sure. Thank you for coming on mute and engaging with us. All right, Dr. Sally. So next, I know it's another question from Nancy. And so Nancy, do you want to come off mute and ask your question, or you want me to ask it?
No, you can do it.
Oh, perfect.
Thank you.
Okay. No problem. So Nancy asks, what factors drive hesitancy towards the HPV vaccine? And how does this hesitancy compare to patterns observed with other vaccines in recent years?
Okay, that's a great question. I'm going to do my best to answer it. Though, if there's anyone who does primary care, please feel free to jump on and add in. So, of course, in younger folks, you can imagine there's some hesitancy that the vaccine will encourage promiscuity, that younger folks will see this as like some protection against all STDs when it's really just for HPV. So a lot of education on the behalf of pediatricians and adolescent health providers has been sort of around saying at some point, it's not encouraging promiscuity, but at some point, every single person in their entire lifetimes gets exposed. This just prevents cancer, right? So a lot of it's been about that. But I'd say recently, I think a bigger public health issue has been the misinformation that's being pushed about vaccines in general. Starting with the COVID vaccine, now with flu. And this is certainly carrying over to how our community perceives vaccines at all. This is a vaccine that is evidence-based. It has been tested in randomized control trials with high quality evidence that shows its efficacy to prevent cancer. So I can't encourage it enough. But I do think that that's something that, a lot of our healthcare providers out on the front lines, a lot of the misinformation they're having to battle today.
Amazing, amazing, Nancy. I hope that answered your question. You definitely informed me. Next, I believe it was a question from Reverend Dr. Tyrone Williams. Would you like to ask your question, or would you like me to ask it? Want to give people a chance to come off mute.
You can ask it.
Perfect. No worries. I got you. So, excuse me, Dr. Williams asked, aside from limited healthcare that's available in rural communities, what other factors contribute to there being a high risk of HPV, such as the environment?
Such as the environment. So HPV, I guess, it's prevalent everywhere. I know of a colleague who's but I know you're kind of asking this question, are there known communities, maybe there's more clusters of high risk strains? That's something that hasn't specifically been asked yet. I know of a colleague up in West Virginia who's running that exact study. But it's more about folks who have, who experience, sociodemographic barriers to health. There's also like a correlation with health behaviors. So really it's about if you have more sexual partners, it's just, it's a lottery system, right? The more partners you have, the more likely you are to get exposed to that high risk HPV strain. So it's not really a matter of location, but it's just a matter of kind of exposure. I don't know if that answers your question.
Perfect. That answer this?
Does that make sense?
Yeah, I understand that. I was just wondering, because of there being health disparity issues in rural communities as well, that also could be a factor. I don't know if the environment, such as it being agricultural or what have you, if those are potentially factors as well that increase the level of risk?
I do think so. Again, I don't know if there's we don't have any specific links, but I imagine like exposure to chemicals, lack of sleep, because you're working these crazy hours, stress in your life stressors, all those things reduce the efficacy of your immune system, right? So basically anything that we know makes your immune system not work as well. It makes you more likely to get those precancer and cancers from HPV. Your body can't fight it off as well. So I do think that there's a piece of, not just exposure, but your lived environment, right? So your environment sort of interacts with the host, with the body, to sort of determine what happens next. It impacts that natural history of it. Yeah.
Thank you.
Yeah.
Perfect. No, thank you. And next, I saw a question in the chat from Paula Rivera. If you want to, would you like to come off mute and ask your question, or would you like me to ask it?
Please, you ask it.
No worries. Okay, so
Everyone
the question
likes
that
you,
Paula,
Jarrell.
and I'm so thankful. I feel like this. Okay, I'm telling you, y'all are blowing my head up. Before you know, I'm gonna tell everybody I'm Beyonce. So, but next, Paula asks, have you ever identified barriers to follow-up care after an abnormal cancer screening result? If so, have you observed differences across racial or ethnic groups?
100%. The PAP, getting a PAP or an HPV test is really just the first step. And often those follow-ups are some of the biggest barriers to actually preventing progression. Because Black women, communities of color, we know that there's lower health insurance coverage, more socioeconomic barriers, more health literacy barriers, all these things. So it comes into play, like people think they just go, they get their test and they're done. And then if number one, a doctor may call them and not explain the results in language that they understand, right? So it's on the provider's end. The provider, though, may have trouble reaching that patient, right? This person may be working. They can't take phone calls during the day. They may not have a cell phone that's real, that they can reliably take phone calls from. Their numbers may come and go. They may be someone who moves frequently. So if a provider tries to send a letter, it gets lost. So there is definitely this disconnect between, those people that have abnormal results. Doctors on our end don't do a good job of explaining what it means. And then I think just a health system barrier is also being able to track those people over time and find them and make sure that they have the resources that they need to get follow-up care. Another piece of that is cost and insurance. As I mentioned earlier, a lot of these we get people free PAP tests through the Every Woman's Life program, but doesn't necessarily mean they're going to have health insurance and coverage to get those follow-up procedures like that LEAP or that cone, or for some women, a hysterectomy, right? On top of that, what is their life situation that they can take off time from work, miss the opportunity to make money? Will their boss let them? Can they get a ride to go wherever they need to go? So all these things come into play. So again, those, women that are at higher risk for, some of the exposure are also those women who can't get the preventive care that they need. So hopefully some of these updated guidelines from the U.S. Preventive Service Task Force and our Health and Human Services will help close some of those gaps.
Perfect. Oh my goodness. Amazing answer. I think it's such a multi-faceted issue. Paula, did that answer your question? I hope so.
Yes, thank you. I appreciate your answer.
No worries. Great. Moving along, they're loving you. So Jinlei asks, does pre-cervical cancer always start from CIN1, then progress to CIN2, CIN3? Hope I answered that.
Usually, yes. And not all, I don't know if I kind of captured it well in that little diagram, but not all CIN1 always becomes 2 or 3. So your own immune system may intervene before it becomes 2 or 3 in reverse. So it's kind of a dynamic play back and forth. But those people who have CIN3, yes, they did have CIN1 at some point. We just may not have caught it when it was that earlier stage.
And then, Jinlei, I know this might be, did that answer your question? Do you have a follow-up question with that? It's a little bit out of my depth, so I want to make sure that you get your question answered appropriately. But I've
Oh,
learned a lot.
yeah, that's great. Thank you so much, Dr. Sayer.
Yeah.
Perfect. Just wanted to make sure. I love it. So Amy Williams asks, you say 100% of people are exposed to HPV. If there is a married couple who are faithful for a lifetime and had no partners before marriage, how would they be exposed?
That's a good question. I mean, I'm sure there's exceptions. I guess really when I say 100% of people, I guess my goal with that statement is to normalize HPV. While it is sexually transmitted, I do not think of this as an STD in the traditional sense. There's a lot of shame and stigma that people have with infections that come from sexual contact. But just in the same way that, you have there's staph bacteria that live on your skin. There's also bacteria that live in the vagina, and there's viruses and things that just live in our world. I think of HPV as one of those. So I think my goal was more to like normalize it and not think of it as like, oh, it's just a STD. But sure, if you don't ever have sexual encounters with other folks, then yeah, you won't be exposed. And if you happen to take 2 people with no exposure and they are the only people that they interact with, then sure, there's exceptions to every rule. But again, my goal is just to normalize HPV as a virus in our world that doesn't have any stigma or shame.
Next, Cynthia Epps asked, I know you already said I can read it. Hey, Cynthia said, with so much pushback against vaccines right now, what is being done to encourage people to get vaccinated? And do you think this will increase the cases? I'm thinking of HPV.
I think that is a really good question. I think what's being encouraged is I do think that providers are needing to take more time to really sit down and listen and have a conversation with their patients. That being said, I'll share my concern that I think sometimes like people kind of get in a philosophy that vaccines are bad, and it doesn't matter what a doctor says. It has to come from someone in their community or who aligns with their, social and political beliefs in order for them to be open to this. So I do think that is going to be a challenge, and not just HPV, but like across public health and general vaccines for children. I do think that this will increase cases, but I think it's going to take time before we see it. Again, HPV, once you're infected, for it to cause those changes in the cervix takes 5 or 10 years. We can see direct correlations between like increases in HPV vaccine and decline in HPV related cancers. So what I see is there's probably going to be a tick. I don't think it's going to be where it was pre-HPV vaccine levels, but I do think there will probably be the tick that's up. So it's definitely a public health challenge. I'm so grateful for my family docs and pediatricians and gynecologists who are on the front lines and really having to have these tough conversations, because it's not easy. So I do think this is where community health workers and outreach really becomes critical to success. So for all those folks, thank you for what you do.
Phenomenal, lovely answers so far. Oh my goodness, these have been phenomenal answers, and I think a wonderful conversation, Dr. Salyer. We wanted to win the end of the Q&A, so I think I have another question. I think I might be able to get this one out, and depending on how we answer, maybe one more. So Sharon asked, and Sharon said, I can read the question. Hey, I got you. Although this discussion focuses on HPV and cervical cancer, is it accurate that HPV is also associated with several other types of cancer?
Absolutely. So this causes oropharyngeal cancers and anal cancers, penile cancers, other things that affect both men and women. Again, it was just cervical cancer. So I try to focus my talk on just the cervix. But that's the benefit to the HPV vaccine, is it also prevents those other HPV related cancers as well.
Absolutely. That makes sense. That makes sense. Great answer.
I know
Yeah.
we're wrapping up. I'm going to jump in. There were a couple other questions in line with that. The fact that HPV can lead to other cancers and the self-test. Do we see that perhaps the self-swab could be offered for like anal HPV screening as well?
Yeah, from a biology kind of perspective, you absolutely could do self-swabs in other sites. I think part of it too is just some of the other sites like penile cancers, anal cancers. Some folks may be uncomfortable with those tests, but I'm sure not. So absolutely, if it increases access and screening, I hope that we can get the science to back it up to reduce those cancers as well.
Just not yet. And for individuals who were not born with a cervix, what about testing for high-risk HPV through any of these methods?
Absolutely. It's a simple swab. You're essentially capturing the virus's DNA. It gets inside your cells and then sheds virus. And so you're just kind of capturing those in the environment. So from a biology perspective, it definitely makes sense. I'll be honest, I'll say my ignorance. I don't know as much about those sites, but I would think it would make sense. Maybe that's homework for us all. We can all look that up when we get off the.
Okay, the connecting together, the connected and conversation together. We're coming back together to see what we found. I like that.
You see, our colleague, Dr. Sutton, has a question. You want to ask that real quick before we wrap up the Q&A, Dr. Sutton?
Actually, Dr.
comment.
Dr. Sutton and Dr. Rhodes are sitting together, but Dr. Rhodes got kicked out of the Zoom.
I thought you disappeared.
So just from the perspective of a colorectal surgeon, I just want to help people understand that that self-swab is not, up inside the anus. It's actually on the anal skin, because this is impacting the skin in terms of anal cancers. So Emily Rivet, who is one of our colorectal surgeons, is very much pushing for self-collection for HPV testing to prevent anal cancers. So I just wanted to throw that in.
Great. Thank you so much. I knew someone would have a good answer for that.
Absolutely. Absolutely. And with that, I think that might be our question. So I think I want to ask one more thing of you, Dr. Salyer, before we move forward in the programming. What's one thing that you would like to leave your audience with? I think you've made it hot. I think the audience has enjoyed you. So what is those lasting notes that you could leave us with before we move on?
Lasting impression. So I think we all know the importance of, like I said, HPV vaccination, cervical cancer screening, but I think one of the toughest parts of my job is just, also, providing folks with the social supports that they need to access these services. On a day-to-day, I always tell people treating the actual cancer is often the easy part. It's all the other stuff, making sure people have food and transportation and a safe place to live. This all comes into people's overall health. So again, just kudos to all the work that goes into social work and providing our patients with social supports, because I think if we lift people up as a whole, then the preventive and healthcare stuff becomes easy. So lasting thought.
Yay. Thank you so much. You warm my heart. Thank you. You were so amazing. I think I could speak for everyone here. We're saying we're just so appreciative of your time and just everything that you do to just help in this work. So again, just thank you. And we're so happy to have you here. So thank you for coming.
Yeah, thank you so much for having me. This was fantastic.
If you want to connect with the Massey Office of Community Engagement, you can connect with us by email at engagemassey@vcu.edu or by phone 804-628-0896. And that's 2 ways that you can connect with us. And then finally, too, I want to say for the cancer resources, this link tree has a load of resources. It's a newer resource asset that we have here at Massey. I'm encouraging community members, if you haven't already, scan that link, click that link. It has information about cervical cancer, and most other cancers as well as screening. So I'm encouraging you guys to connect with that. It also has community resources as well. And if you have any questions about that link afterwards, please feel free to use the Engage Massey email or call us even. And so next are Massey printed cancer education materials. So as you see right here, you should see some familiar faces on your screen. So what you are looking at is our screening rack cards. If you came to last month's meeting, you might have saw the lung cancer ones, which those are on screen as well. So the left right here, you can see for January, our cervical cancer awareness one. So community members, you guys can request this. We're encouraging you guys that if you know any local faces, any survivors or advocates that are really passionate about cervical cancer, and they're looking to actually have their face on this card in their local community when you're distributing these, please reach out to us at the Engage Massey email or call us. We would love to have a conversation about how we can do that. Basically, that person would sign a release form and we get that done. And again, if you know anybody for lung or breast as well, please feel free to reach out. We'd love to get some more local faces on these cards. And you can request these as well. So the save the date. Dr. Rose said, and I'm gonna read this because yes, I really feel this. She's saying, we'll see you in February. We hope you spread the word and bring other community members to the forum with you. Save the date. The Massey Community Forum will happen on the 4th Tuesday. So you see, not second, we move to the 4th, honey. So 4th Tuesdays every month. Next month's topic will be colorectal cancer awareness. It will happen February 24th, 2026 from 1 to 2 p.m. Zoom information will be impending. So expect to see that in your email. If you sign up this time, we'll just connect with you this time. So again, we just want to thank you again for coming out to the Massey Community Cancer Forum, where cancer community and conversation connect. And we can't wait to see you again next month. All right, everybody. Bye.